One of the biggest arguments I've been seeing lately against the healthcare bill is that there'll be rationed care. Someone on a panel will decide if you live or die. Well, for one thing, that's not a reality. It's fiction. There's nothing in the bill that says that care will be rationed, nor is there any kind of death panel that's going to decide whether or not you unplug grandma. I don't know how many of you have been through our healthcare system lately, but I recently had major surgery, and I have what's supposed to be good insurance. After my surgery, I got a bill in the mail for my anesthesia saying that it wasn't a medical necessity. Of course, I would have died if I didn't have it, so in my opinion, that's a medical necessity. I eventually got them to pay for it, but it took a long time. I had to fight them tooth and nail to pay for a medical necessity. And this is insurance that I have through work that is supposedly one of the best. You're not taking into consideration that healthcare is rationed as we speak at an alarming rate. The thing is it's done for profit. And you have people like the CEO of United, who at one point was getting one out of every $700 spent on healthcare in the United States directly in his bank account. This is why they're fighting so hard to spread misinformation, and make sure that you go out to these town hall meetings and scream and yell and be pissed off. Even though if you watch these protesters, most of them have absolutely no clue what they're pissed off about. Seniors are pissed because they're supposedly going to be killed by a death panel because they're not productive citizens anymore, which is complete bullshit and has been proven to be complete bullshit. All you have to do is read the fucking bill, and there's nothing there that exists. This rumor was created by, I can't remember the bitch's name, but she's a Republican representative now who used to work for the medical industry and has created this fictitious death panel of people who will decide whether or not you unplug a family member, who's in a coma or whatever. And it was further spread by the troglodyte Sarah Palin. It's not reality. It's not based on reality. It's based on part of the bill that says there is optional guidance for end of life. Meaning if you find out you're going to die, if you want, you can go to a doctor and talk about it. It also lets you make a living will so that you can say what you want to have done when you die. Now, does that sound like a panel of people that will decide if you're a productive enough citizen to be worthy of health care? Not to me.